Hey there, and welcome to this explainer. We're jumping right into something that honestly might sound a bit like a dry administrative chore at first glance, but I promise you it's actually the bedrock of our entire healthcare system. Today, we're unpacking South Carolina nurse license verification. And whether you're an employer staffing up a whole hospital, a patient trusting a local clinic, or maybe you're a nurse yourself, getting a grip on this process is absolutely crucial. I mean, really stop and think about this for a second. Who is actually caring for your patients? When you walk into a clinic or, admit a loved one to a hospital, you just naturally assume the person in scrubs is highly trained and legally supposed to be there, right? But if even a single unverified professional slips through the cracks, it can compromise a whole facility. It endangers lives and shatters trust in an instant. The stakes literally could not be higher. So, when you step into that clinical setting, you see the clipboards, the scrubs, all that focused care, you expect excellence, for sure. But that expectation relies 100% on proof. Verifying a nurse's credentials, that's your ultimate safeguard for patient safety and trust. It guarantees that the person handing out medication or making those split-second health assessments has actually met the rigorous educational and legal standards required. It's not just a suggestion, guys, it is an absolute necessity. All right, so here's our roadmap for this explainer. 1. Why verification matters. 2. The SC Board of Nursing. 3. A step-by-step guide. 4. License statuses. 5. Challenges and APRNs. And finally, 6. Legal boundaries. Okay, let's kick things off with Section 1, Why License Verification Matters. It's easy to assume this is just some HR checklist thing. But did you know state law actually considers simple orientation, like just reading the facility's policies, to be the practice of nursing? Yeah, you need a verified license before even walking in the door for day 1 of training. To really grasp the gravity of this, listen to their official mission statement. The mission of the State Board of Nursing for South Carolina is the protection of public health, safety, and welfare by assuring safe and competent practice of nursing. So every single time you verify a license, you're literally participating in the protection of public health. Moving right along to Section 2, the South Carolina Board of Nursing. To really get how this whole system works, we kind of need to know the architects behind it, right? The board operates under the South Carolina Department of Labor, Licensing, and Regulation. Most people just call it the LLR. Together, these guys act as the ultimate gatekeepers for public safety. They govern licensing for LPNs, RNs, and APRNs. But they don't just hand out licenses and walk away. They actively investigate complaints and drop disciplinary actions when they need to. And most importantly for us today, the LLR maintains those real-time online portals that let anyone check a credential instantly. Which brings us to Section 3, our step-by-step verification guide. Honestly, the process is incredibly simple. You literally just need a web browser. The official LLR online portal is your absolute best, most authoritative local source for checking South Carolina's single state licenses. And get this, it's updated nightly by the LLR staff. You don't even have to create a pesky login or account to do a basic search, and the whole thing is completely free to use. This is going to be your go-to tool. So here's your quick 4-step tutorial. First, just visit the LLR licensee lookup portal online. Second, type in the nurse's first and last name, or, even better actually, plug in their specific license number if you have it. Oh, and here's a great pro tip straight from the board. You don't even need to enter the full name if you're not sure how to spell it. Just popping in J for the first name and Smith for the last name will pull up all the matching records. Pretty handy, right? Third, hit submit. And fourth, just click on the matching record to see their current status, expiration date, and any public disciplinary history. It really is that straightforward. But wait a second. What if the nurse has a license from a totally different state? Well, since South Carolina is part of the Nurse Licensure Compact, or NLC, nurses from other compact states can actually practice here without needing a specific South Carolina license. And this is exactly where we need to contrast our two main tools. You'll want to use the SC LLR portal for single-state South Carolina licenses. But if you're dealing with a multi-state compact license, or honestly, if you just aren't sure which state issued the primary license in the first place, you're going to want to hop over to the national database called Nurses, and specifically use their Quick Confirm tool. All right, Section 4, Interpreting License Statuses. Finding the record is great and all, but interpreting these statuses is where true compliance actually happens. Active means exactly what it sounds like. They're licensed, in good standing, and good to go. Inactive means the license isn't being used right now, but it could be reactivated later down the line. Now, lapsed or expired means they missed their renewal deadline, which in SC is typically April 30th. Suspended means a temporary disciplinary action is blocking them from practicing. And revoked means the state board permanently pulled the plug on that license. So, the big takeaway here, anything other than active means that individual cannot legally provide care, period.
Next up is Section 5, Challenges, APRNs, and Support Resources.
Because it's a complex system, there are always going to be a few edge cases. And here is a super specific but absolutely critical nuance if you happen to be an advanced practice registered nurse, like a nurse practitioner, looking to move and get licensed in another state. Get this, South Carolina does not export APRN data to the automated nurses system. Crazy, right? So you can't just use those standard online nurses pathways. Instead, you have to request a manual verification. You'll log into the LLR e-services portal, select online license verification request, and pay a non-refundable $5 fee. After that, the South Carolina board has to manually compile and send your history over to the new state.
Now, if you ever get stuck or if you spot a weird discrepancy in a lookup, don't worry, you aren't on your own. You've got lifelines. You can call the board directly at 803-896-4550 or shoot them an email at nurseboard@llr.sc.gov. Their physical office is at Synergy Business Park in Columbia. Oh, and if you're representing a massive healthcare system and the thought of looking up licenses one by one sounds like a total nightmare, the LLR actually offers a bulk license verification tool that's built specifically for high-volume screening.
And that brings us to our final part, Section 6, Legal and Ethical Boundaries. Okay, I literally cannot emphasize this next part enough. The LLR lookup tool is strictly for informational and credentialing purposes. It is absolutely not a consumer report. Under the Fair Credit Reporting Act, the FCRA, you cannot legally use this tool all by itself to make final employment, tenant, credit, or insurance decisions. If you're an employer, you still have to use an official FCRA-compliant background check provider for your official hiring decisions. The LLR portal tells you if they're licensed. It does not replace a full-blown background check. Which brings us to the end of this explainer and our professional disclaimer. While we've done our best to provide a really comprehensive guide here, you should always refer directly to the South Carolina Board of Nursing or consult a legal professional to get the most current and tailored advice for your situation. Remember, verifying a license isn't just checking an administrative box. You are literally acting as a guardian for patient lives. So the next time you or a loved one steps into a clinic, are you just going to assume the person in scrubs is qualified? Or will you take that verification into your own hands? Thanks so much for joining me today, and stay safe out there.